Welcome, everyone. My name is Gaurav Vaidya, and I'm a member of the HEAL Data Stewardship Group. I want to thank you all for joining us today for the 11th installment in our Fresh Fair webinar series. Today's webinar is called Increase Your Impact Factor, Study Registration on the HEAL Data Platform, and will feature presentations on how HEAL investigators can register their study on the platform and provide metadata describing their study, as well as lightning talks on study-level metadata and the registration experience. We will then have a panel discussion and Q&A. Next slide. If at any point you have any questions, please feel free to type it into the Q&A box. Next slide. We are joined today by panelists Marisa Briones and Georgene Hergenroeder of the HEAL Collective Board. Marisa Briones, PhD, is the CEO and co-founder of BDH Pharma in Los Angeles, California. Dr. Briones earned her PhD in molecular and medical pharmacology from the University of California, Los Angeles, where her graduate work focused on pharmacokinetics, drug-drug interactions, and mechanisms of drug action. She has over 10 years of extensive research experience, ranging from basic preclinical research, translational science, clinical research, and clinical trials. Georgene Hergenroeder, PhD, serves as Associate Professor in the Vivian L. Smith Department of Neurosurgery at the University of Texas Health Science Center at Houston. Dr. Hergenroeder's primary research interests center on improving patient outcomes after spinal cord and brain injury. Her research focus has been on biomarker discovery in order to predict which patients may benefit from future intervention. And presenting today are Phil Schumm, Eric Giger, Allie Gartland-Gray, and Brady Granier. Phil Schumm is a statistician and director of the Research Computing Group in the Department of Public Health Sciences at the University of Chicago. He has served as technical director for numerous data coordinating centers, including the NIDDK-funded Inflammatory Bowel Disease Genetics Consortium and the International IBD Genetics Consortium, for which he has led development of a data commons. He is co-PI with Robert Grossman of the HEAL Data Platform and co-leads the Data and Analytics Support Core for the NIDA-funded Justice Community Opioid Intervention Network, or JCOIN. Eric Giger received his BA in Economics from the University of Chicago. He's been with the Center for Translational Data Science at the University of Chicago since the beginning of this year. Having previously worked on the data collection end of clinical addiction research, Eric now provides user support to researchers on the HEAL Data Platform, eager to help those helping to end addiction long-term. Allie Gartland-Gray, MPS, is a research data analyst in the Research Computing Division at RTI International. She has experience in data collection, management, and storage, and has nearly 4 years of experience working in the field of health informatics in a combination of both academic and professional settings. Ms. Gartland-Gray's educational background is in biology, biomedical health, and informatics, and she leverages this knowledge as a HEAL steward to help develop tools and guidance for research data governance, curation, and deposition. Brady Granier earned his Bachelor of Science degree in nursing in 1995. During his nursing career, he specialized in the critical care areas of ER, ICU, CCU, and CICU. He also moonlighted as a home health nurse, critical care air transport nurse, and TV studio set medic. In 1996, he moved to California as a travel nurse and spent most of his remaining years in healthcare as the charge nurse in the emergency room at White Memorial Hospital in downtown Los Angeles. After leaving nursing and during the 12 years prior to joining BioCorRx in 2013, Mr. Granier was involved in sales management, media sales, and business development. A few years after returning to healthcare, he co-founded BioCorRx Pharmaceuticals, Inc., after seeing the need to develop more medications to treat addiction, such as BICX104, an implantable naltrexone pellet for alcohol and opioid use disorders currently in human trials. With that, I'll pass it over to Phil to begin the presentation.
Thank you very much, Gaurav. My name is Phil Schumm, and I'm part of the team that has been building the HEAL data platform. In this webinar, my colleagues and I are going to tell you a little bit about the HEAL platform and how you can begin interacting with it, specifically by registering your study and providing study metadata. Next slide, please. So today, we're going to cover the following topics. We're going to tell you a little bit about what the HEAL data platform is. We're going to tell you what study registration is and why you should do it. We're going to tell you how to register your study. We will go over what study metadata are and what they're used for, as well as how to enter the metadata for your study. And finally, and most importantly, we will make sure to tell you where to go for help or more information afterward, should you want it. Next slide, please. So here is a little schematic that hopefully will give you a little sense of what the HEAL data platform is. And at the center of it is you, the HEAL investigator or member of a HEAL research team who are creating data. Now, your study already has information about it, metadata, in various places. NIH Reporter, which I'm sure you're all familiar with. And if you are doing human subjects research, then if not already, soon there will be metadata about your study in clinicaltrials.gov. Today, we will be telling you also about another mechanism for providing metadata called the Center for Expanded Data Annotation and Retrieval, or CEDAR. And the platform makes use of that mechanism to allow you to provide additional information about your study. Next slide. Now, consistent with both NIH and HEAL data sharing policies, you all will at some point share the data you are generating, in most cases by submitting them to a NIH or other data repository. We've identified roughly 24 such repositories that are prepared to work with you, depending on the nature of your study and or the type of data that you are generating. Next slide, please. So the HEAL data platform is a secure cloud-based platform that is capable of interoperating with all of the sources of metadata and data that you see here, in order to provide a single location where users can come to search for and discover studies, learn about them, and then for authorized users to access data from those studies, and if they want, to compute over those data in secure cloud-based workspaces. One thing I will simply mention parenthetically is throughout all of this, it is the repository where you have submitted your data that controls who is able to access your data and what, if any, restrictions on how the data are used are applicable. The platform does not get involved in that. It simply provides a single place where users can access metadata and data according to the procedures put in place by the local repository. Next slide, please. Now, platform registration, this is the first topic we're going to talk about today, is what allows this to happen. And in particular, what it does is it establishes a link between your study on the platform and both the sources of metadata for that study, and then also where the data from that study will be deposited. Next slide, please. And the red arrows here show the part of the process that we're going to focus on today. Specifically, platform registration, which you do via a form on the platform, And then once you have done that, providing metadata about your study into CEDAR, which will then be available through the platform. So Eric, I think I'll hand it over to you now.
Thank you, Phil. So we will now present two brief videos that will walk you through study registration. These videos are accessible via YouTube and will be sent out to attendees following the webinar.
Welcome to the HEAL Data Platform Study Registration Demonstration. Study registration involves requesting access to register your study and subsequently registering your study on the HEAL Data Platform. To permit the platform to pull information from additional sources, a study must be registered. Registration is the process of linking a study to one or more metadata and data sources, such as CEDAR. In order to complete study registration, you will need an account on the HEAL Data Platform and an account with the CEDAR Metadata Service. Study registration can be completed in 20 minutes. However, note that requesting access to register your study has a turnaround time of 1 business day. This video will cover how to request access to register your study. You may register your study at any time, even if you're not yet ready to submit data to a repository. Begin by navigating your web browser to healdata.org. Next, by clicking on the Discovery button, we can open the Discovery page where we can use free text search to find our study. Click on the search bar. You can search for your study by principal investigator, study title, or grant number. Here, we're using PI first and last name. Having found our study, we'll then click on it to bring up its very own study page. Select the Login to register this study on the upper part of the study page, and log in using your preferred option. Note, if you cannot find your affiliated institution on InCommon, please check to see if it is supported through ORCID. You may also use an individual ORCID or Gmail account. Once you have logged in, note that the upper option on the study page has changed to Request Access to register this study. Clicking on this link will bring you to the Study Registration Access Request form. Upon arrival, please note the study name grant number field has been auto-completed with the study we're requesting access to register. Please complete the form by providing your name, your email address, institutional affiliation, and role in the project or study. Once you successfully submit the access request, you will be greeted with the confirmation message. Please allow up to 1 business day for the access request to be approved. You will be notified of your approval with an email containing the next steps of study registration. Thank you.
All right, now that you have been approved to register your study, this next video will guide you through the end of registration.
Welcome to Part 2 of the HEAL Data Platform Study Registration Demonstration. This video will cover how to complete the study registration process. Before viewing this video, you should have received an approval email after having requested access to register your study with the HEAL platform. Begin by navigating your web browser to healdata.org. Next, click on the Discovery button to open the Discovery page. Clicking on the search bar, we'll be using Principal Investigator to find our study again. Having found the study, click on it to bring up the study page. Select the Login to register the study on the upper part of the study page, and again, log in using your preferred option. Once you have logged in, note that the upper option on the study page is now Register the Study after you've been approved. Clicking on this link will bring you to the study registration form. Arriving at the study registration form, please note the study field should be automatically populated with the study we're now registering, as well as any other study we've received approval to register. The only other required field is for your Universally Unique Identifier, or UUID, from CEDAR. Clicking on this link to the right here will bring you to CEDAR's login page. Please sign in if you already have a CEDAR account. If you do not have a CEDAR account, logging in with Google, GitHub, or ORCID is supported, or you can register for a CEDAR account yourself, which only requires your name and your email address. After signing into CEDAR, click on the Head and Shoulders icon on the top right corner of the page. This can navigate you to the CEDAR profile page. At the top of the CEDAR profile page is your CEDAR user UUID, which we can copy now as we will need it to complete the study registration form. Returning to the HEAL data platform, paste your CEDAR user UUID into the study registration form. If you know the clinicaltrials.gov ID for your study, please enter it at this time. You can also enter repository information at the bottom of the form. As we have mentioned before, you may register your study at any time, even if you are not yet ready to submit data to a repository. It is acceptable to leave repository information blank if you do not know yet. After submitting, you should receive a message indicating your study registration was successful. Registering your study on the platform is an important first step in the data sharing process, promoting discoverability and enabling others to learn about your study. From this page, you can easily navigate to CEDAR to begin completing the CEDAR metadata form associated with your study. Be on the lookout for future demonstrations diving into working with CEDAR metadata forms in order to submit study-level metadata.
All right. So now that you've seen how to register, I'd like to give you a few reasons why you should register and complete your CEDAR form now. So your study has already been loaded onto the platform based on information available on NIH Reporter. Registering allows you to verify how this information appears on the platform. During registration, you are given the opportunity to link to clinicaltrials.gov so we can pull metadata from that source. Completing your CEDAR form allows you to provide robust study-level metadata, which will allow your study to be findable in new ways. This all increases the visibility of your research. More people will be able to find as well as learn about your study or project. Providing metadata increases discoverability and in turn increases the reach of your research. It allows the community to benefit from the research you've done. Not only does it comply with the data sharing requirements, study registration can facilitate subsequent data sharing to maximize overall scientific value. With regard to data sharing, registering allows your chosen repository to anticipate your submission, and the information you provide in CEDAR may be transferred to your repository when you're ready to submit data. And finally, by registering now, you can indicate to other researchers your intentions to share data, which would allow them to plan accordingly. This will ensure the broadest audience can begin anticipating the data that you will share from your study. This can lead to scientific collaborations of various kinds in the not so distant future. So we anticipate that some of you may have only learned about CEDAR from the registration videos we previously viewed. CEDAR stands for the Center for Expanded Data Annotation and Retrieval. The CEDAR Workbench is an online platform specifically designed for the creation and management of structured metadata according to the FAIR principles. These metadata forms, or templates, conveniently link out to BioPortal for biomedical ontologies. The HEAL data platform will then pull these entries from the CEDAR templates into the platform to enhance search capabilities and provide increasingly robust study details. Among its functionalities, not only is it easy to use, but offers the ability to collaborate on forms. So let's say that you've just registered your study. As I've just mentioned, one of the great features of CEDAR is the shareability of metadata forms, this ability to collaborate. While one individual will register a study on the platform, multiple team members can collaborate on a single CEDAR metadata form. As the registering member shares the study's CEDAR form with other team members, each team member will need a CEDAR account to contribute. In other words, the registering member does not have to be the one to complete the form. It can be delegated. So after logging in, you'll see the options Workspace, Shared with Me, Shared with Everybody, and Community folders. After registering your study, a metadata instance will be created and available under Shared with Me. Finding the form associated with your study, click on the vertical 3 dots to the right of the form and select Share. You can then type in the names of team members you'd like to share the metadata form with. If you can't find a team member's name, they most likely do not have an account and will need to create one. Again, we anticipate that CEDAR may be new to a lot of you. I want to take some time to familiarize you with the forms, removing the veil a little bit and provide some best practices. So CEDAR forms will open in an expanded format with all metadata fields visible. Section headings are in green text and metadata fields are in black. We recommend collapsing each section and expanding them individually as needed as you move through the form. Our first best practice would be to save often. Information that you've entered into your CEDAR form is not saved automatically. We recommend saving often to ensure you do not lose any progress you've made on the form. To save, click Save on the bottom right of the form. Note that saving will not close the page or redirect you. Additionally, if you try to navigate away from the page without saving, you'll be greeted with this message, giving you a reminder to save your progress. So some sections or fields of the CEDAR form will not be applicable to all studies. For example, several fields in the human condition applicability section only apply to studies focusing on a human pain condition or treatment of a human pain condition, and do not apply to studies focusing on a human opioid use condition or treatment of a human opioid use condition. We want to provide as much assistance as possible, so CEDAR allows us to customize a tooltip, that little question mark that you see on the top right there, to provide some base support in the interface itself. So if a form section or field does not apply to your study, you can skip it. If you have questions about whether a section or field applies or does not apply to your study, please reach out to HEAL support. And finally, we highly encourage investigators or other study staff to provide this study level metadata as soon as possible following notification of your HEAL award. The HEAL data sharing policy requires all HEAL funded studies to be registered on the platform within 1 year of award. For people doing human subject research that is reportable in clinicaltrials.gov, the optimal time to register your study is right after you register in clinicaltrials.gov. Some of these metadata fields will be pre-filled, as some metadata can be pulled in through NIH Reporter. The CEDAR form has been calibrated to include only fields that appropriately knowledgeable study staff should know and be able to fill out as soon as HEAL funding has been awarded. Reminder that this is metadata we're talking about, not the data itself, so there's no need to wait for data collection to start in order to fill out your CEDAR form. You can complete the form in more than one session if you need to. And there are some fields you may want to update over time. For example, data collection status will need to be updated from not started to finished over the life cycle of the study. We ask that you complete these fields to reflect current study status of your study at the time of completing the CEDAR form. It may be beneficial to review what these forms require before filling them out, so you can gather all necessary information beforehand and be ready to go when you sit down and start filling it out. So HEAL support and the entire data platform team is here to help you through this process. I'd like to take a brief moment to draw your attention to our HEAL data platform documentation, which is our user manual of sorts, offering help and guidance navigating the platform. And now some key takeaways. So first, providing metadata increases the discoverability, which in turn increases the impact of your research, which can be done before data collection even starts. And number two is that we at the platform and stewards teams are committed to helping address this important public health issue by facilitating data sharing to maximize their value. We want you to feel supported through this process. We're here to help you in any way we can. And if you have any questions or concerns, please contact HEAL support. I'll now pass it off to Allie so we can learn more about study level metadata.
Thanks, Eric. Yeah, perfect. So I'm going to talk a little bit about HEAL study level metadata, but first I wanted to give a quick refresher on metadata in general. So what is metadata? Put simply, it's a description of your data that helps make the data findable and usable. So what is study level metadata in the context of HEAL? Study level metadata is information about your study that people might use to find and identify your study and to understand whether or not your study is something that they're interested in learning more about. So some simple examples are study name, study description, and study subject type. And if your study involves treating a human condition, for example, other study level metadata fields are condition category, treatment type, subject age, and so on. Okay, so now that we have a better understanding of study level metadata, let's go over a few scenarios where it would be beneficial. So maybe there's a patient with a pain condition that's been treated unsuccessfully so far, and that patient wants to search for novel treatments to discuss with their doctor. They could search the platform using filters to find the studies that are relevant to their needs, as you can see in the figure on the right here on the slide. Each of those filters represents a HEAL metadata field. So similarly, maybe a clinician is treating patients with opioid use disorder and is interested in identifying risk factors for relapse. Or maybe a researcher just wants to find others conducting similar work in order to identify potential opportunities for collaboration. In all of these scenarios, it's the study level metadata that will help narrow down the search and allow users to find exactly what they're looking for. Next slide, please. So as a HEAL researcher, you'll provide study level metadata via the interactive CEDAR form that was described earlier. So I'm going to walk through a couple of frequently asked questions about providing study level metadata via the form. The first question is, if my study has not begun generating data, can I still fill out the CEDAR form? And Eric spoke to this a little bit earlier, but just to reiterate, yes, you can. The purpose of the CEDAR form is to collect information about your study, not your study data. Sharing study level metadata as soon as possible will help make your data more fair, which stands for findable, accessible, interoperable, and reusable. And in particular, sharing study level metadata will address the F and the A portions of FAIR, so findability and accessibility. It'll also help connect your data to the HEAL ecosystem, as well as promote collaboration among researchers. There's no such thing as sharing study level metadata too early because the metadata are easily modifiable too. So if something changes down the line, it can be easily updated. The next question is, if my data are not shareable, should I still fill out the CEDAR metadata form? And the answer to that is also yes. So again, the CEDAR form will only collect information about your study, and you will not be asked to provide any sensitive information. Even if your data are not shareable, providing study level metadata will still be useful for other community members looking to learn more about your study. And the metadata can still point to publications, which could result in increased citations. The overarching benefit here is that contributing metadata to the platform is a network effect. Each PI who contributes metadata increases the value of not only their study's metadata, but every other PI's metadata as well. Increased participation from the HEAL community will improve the value of the platform for all, resulting in a greater likelihood of research and clinical breakthroughs. And with that, I will hand things over to Brady. Oops, Brady, you're on mute.
Sorry about that. Can you hear me now?
Yes.
Can you hear me now? Can you hear me now?
Yes, we can hear you now.
Okay, sorry about that. Yeah, so I just wanted to basically validate everything that's been said today in terms of registration. You know, I'm a sponsor, I'm not the PI. But as a sponsor going through this registration process, it was as easy as was just shown in these videos and explained. So far, it's been seamless. It's very intuitive in how you register your study into the system. I've encountered no issues. I used Google to log in and register my account with CEDAR as well. And again, it was a very seamless process to date. I started entering some metadata in as well. Very simple process. And there's a lot of help if you have any questions. But again, my purpose here today is just to let everyone know here that don't be afraid to register. I don't think it took the 20 minutes they're saying it takes. I think it's really quicker than that. So if anyone has any questions about, specifically what I did to go through my process, I'm more than happy to help. but I'm here to validate what they're saying here. It is that simple. And now with that, I can turn it back over to Christoph.
Awesome. Thank you so much. And thanks to all our presenters. So now we'll invite our panelists to join us, and I'll ask them all to turn on their cameras. We will now stop screen sharing to begin the panel discussion, which will then be followed by a Q&A. If you have any questions that you'd like to ask our panelists during the Q&A, please use the question feature on your Zoom screen in order to ask those questions. All right. So the first question we have for our panel is, what if I can't find my study? And would someone from platform like to answer that?
Yeah, I can take this one. So if you can't find your study, so we've preloaded all the information available to us. Sometimes the Granier words do not sync up with the study units themselves. So this is one of the reasons we like people to engage with the study registration process. So please check to see if you can find your study. So that's already a great first step in the registration process.
And I would just add to that, Eric, if you are unable to, then please contact us at the help email, and Eric or somebody else will help you.
Awesome. Next question. What is the HEAL data ecosystem? Allie, do you want to take that one?
Yeah, I can take that question. So the HEAL data ecosystem is made up of several parts, and we have this graphic here to help. But so it's made up of the HEAL studies and study data, HEAL compliant repositories, the HEAL data platform, and then of course everybody in the HEAL community. So investigators will submit both data and metadata to the repositories, and then only metadata to the HEAL data platform. So the metadata will be added to a searchable metadata catalog, and then the platform will help the studies and study data become more findable and accessible through that metadata catalog. And for comparison's sake, we like to compare it to the website kayak.com, if anybody's ever used that. So Kayak lets you search for flights from multiple different airlines, and you can filter down until you find the flight that best meets your needs. And then when you decide to book the flight, Kayak redirects you to the actual airline's website to complete your booking. And that's essentially how the ecosystem will work. A user can search the platform for the specific study that they're interested in, and then the platform can point the user to the repository where the study data are housed.
Awesome. Thank you so much. Next question. And this is for those of the panelists who have experience registering a study with the platform. What was your experience registering your study?
I can start off with that one. It was actually much easier than I thought it would be, which is wonderful. Initially, I was surprised that I had to register and then wait for the registration be approved. And I'm one of those people that likes to touch a paper once and move it along, so I don't waste a lot of time. And fortunately, when I registered, my approval came back very quickly. The one problem I encountered when I got on CEDAR was when I couldn't find my study. So I did utilize the help, and help also came back very quickly, which was wonderful. And it was because I had pressed all kinds of things on the CEDAR platform to try to find where I needed to be. And I was told, oh, unclick these things. And sure enough, there was my study. So the help was very efficient and gave me the right answer. And the actual registration took probably 20 minutes, like you're saying, very easy.
Just to add on to the experiences so far, it was very simple for me as well. And basically, I was able to submit my request to register, came back within a minute. went ahead and started searching on CEDAR. I used my name to search, was able to very quickly find my study, and I was able to complete the entire process with maybe 5 minutes. It was very, very simple and straightforward.
Yeah, same for me. It was that simple. It wasn't 20 minutes, as I said earlier. I mean, it was too easy. So far, so good.
That is awesome. That is good to hear. Next question. Does registration require data submission at the same time?
Well, I'll take that one, and the answer is most definitely no. The registration process is simply exposing information about your study, and at any time subsequent to that, you can submit data. It's the first step, in fact. So for virtually everyone, it will come before you actually are ready to submit your data.
Thank you. All right. Who needs to complete registration? Does it have to be the PI, or can it be a data manager? Does the lead registrant, the person who actually does the sharing, need to be the PI?
So the answer is no. I'm guessing that it's fairly frequent for another member of the research team to go ahead and do this, but there is no restriction on who actually does it, simply that you've been delegated by your PI to do that. The only issue, and I won't say more about it now, but if you recall the process that Eric went through when you register, that generates a CEDAR instance that is linked to your study and that is essentially owned by you. And if you then want to collaborate with others in completing that, there's simply an extra step you have to do. That's all.
Awesome. Thank you. Next question. And this is aimed at our collective board members and at the users of the platform who are on the panel. What do you perceive as the platform's core value proposition?
So I can start. As part of the collective board, we spent quite a bit of time thinking about how users would utilize the platform. And I think the main goal is to essentially create a very convenient central location to access anything that might be pertinent to not only your research, but maybe research that you're thinking about. And similar to the kayak analogy, it's a way to just have a home to go to, find what you're looking for, and maybe a few other things that are linked that maybe you've never considered will be right there in front of you that you can peruse and see what might be pertinent to your research. So I think convenience and centrally located starting point is really one of the big value propositions that this platform offers researchers.
And I agree. I think for us, it's exposure and potential collaboration with other people in the field that are trying to do similar research and ultimately try to help people. And so we want to be able to give back to, and we're very grateful for the partnership with NIH to help us with this research. So I think it's just it makes perfect sense back, and hopefully that can help others.
And to agree with my HEAL platform users, I had a need to find a collaborator to help enroll patients at another site. And through the platform, I was able to identify people working in the same area and could reach out to those collaborators. So proof of principle has already happened.
That is fantastic. All right, next question. What if I'm a part of a group of studies that has a data coordinating center?
So I can take that. The answer in that case is you should start by talking to either your data coordinating center or your program officer. And the chances are great that they are the ones who are coordinating the registration of your study on the platform. So start with them. And if you have any remaining questions, feel free to contact us.
Awesome. Thank you so much. All right. Next question. Can stewards help with submitting my metadata to the platform?
I'll take that one. Yeah, so the answer is absolutely. We're here to help, so feel free to reach out with any questions. There's a connect with us form on our website, which is healdatafair.org, and I think someone will drop that link in the Zoom chat as well. But yes, feel free to reach out.
Fantastic. Next question. Does the system send reminders on a routine basis to update the metadata if appropriate?
So I'll take that quickly. The answer is at the moment, no, and certainly not in any automatic sense, because that's the timing when you might want to update it is probably quite specific to a study. I'll use this as an opportunity to answer a couple of the questions that have come in that I've noticed, which is, yes, you can go back and edit your metadata at any time after, should you want to do that. Yeah, I'll wait for the other ones for Gaurav.
Awesome. Well, thank you so much. We now have our live Q&A questions coming in. And as before, if you have more questions, please do ask them in the Zoom chat. The first live Q&A question: are all studies expected to register? What if our study is not a clinical trial?
So I can comment on the second part of that question. Our studies are not clinical trials either. We're focused on preclinical at the moment, and we're still able to register on the platform. And by using the different metadata links, we'll be able to be searchable to other perhaps preclinical researchers, or be able to connect with other clinical researchers that are, maybe further along in our development of our project. And so you can absolutely still register your study if it's not a clinical trial.
Awesome.
And indeed are requested to. And in fact, again, even if you are not, say, generating data, or if you're in a position where for some reason you're unable to share your data, as you've heard today, registration of your study on the platform with all other HEAL funded studies brings a lot of benefits beyond simply the data sharing component.
Awesome. Thank you so much. Live Q&A question number 2. How long has this platform existed? Has it been difficult for teaching hospitals to obtain IRB approval to use this platform? Have any researchers used data from this platform for publications yet?
So the platform was initially launched this summer. So, it's been in development a little bit before then, but that's the point at which it became sort of HEAL investigators were able to engage with it. I do not believe at the moment that anybody has published with data from the platform yet. And then the only other, this is a detailed question, and if you have further questions about this, please contact us. The only thing I would comment on is simply reinforce the idea, sort of from an IRB and sharing perspective, that it's the repositories where you would be submitting your data, as I said, that determine who can access it, and under what restrictions, not the platform. So it really would be the rules around the repository and so forth that would be most relevant there. The platform just makes it easier. That's all.
And I can add to that, because one of my other hats is as an IRB member. There's nothing that the platform asks that an IRB would preclude from being registered.
Awesome. Thank you so much. All right, live question number 3. Does the HEAL platform continuously update from clinicaltrials.gov, or would our team have to make changes on both platforms?
So the answer there is it does update, but not in real time. So, and any changes that you need to make to your clinicaltrials.gov record should be made in clinicaltrials.gov, and the platform can then pick up that change subsequently, but not in real time. So don't have 2 web browsers open simultaneously and look for one to happen, but
Awesome. All right, question number 4. How can I know which repositories will provide the registration data to HEAL? Where can we learn more about appropriate data repositories that we should use?
I could take that one. So on the healdatafair.org website, there's a repository selection guide, and it has information about, well, it has a list of the HEAL compliant repositories, and then it has information about each of those repositories to help you select one that's appropriate for your study. And in terms of the first part of the question, how can I know which repositories will provide the registration data? So the registration data is for the platform portal, and then your study data will go to the repositories. And as we've said, feel free to reach out if you have any other questions about repositories or need help selecting a repository.
May I just add one quick thing to that, which answers another question in the chat, which is that the idea is that by providing the metadata to the platform up front, when you get ready to submit your data to a repository, you will be able to pull along the metadata you have already provided to the platform. That may happen automatically, or it may be a simple extra process depending on your repository, but you will not need to provide that information again. And in fact, someone asked about Figshare. As you, I'm sure, know, repositories differ in terms of how much they ask for metadata. All of the repositories we're working with, we're working on an arrangement such that what you provide to us is as much or more than they are asking for. So it should really reduce your time required when you get ready to submit your data.
Nice. All right, next question. After someone other than the PI has registered a study, is there an easy way to add access to the PI and other study team members, such as sub-Is and clinical research coordinators, or do they need to also make a CEDAR account?
I think I can take this one. So it can be easily shared, but it is by, they also need a CEDAR account. Yes, it is dependent on that.
Sweet. All right, next question. Once metadata has been entered, can it be changed later? Our HEAL study uses the R61-R33 mechanism that includes a 2-year iterative intervention development period, followed by a 3-year RCT. It is possible that our intervention will evolve based on community input and guidance, hence the possible need to change metadata.
So I'll answer that briefly. As we said before, you may change your study level metadata at any time. And then to your other point, and I think at least one other person asked this same question, these phased awards are something that we have been discussing internally, and we're aware that it may be difficult to represent those. The metadata fields, when you see them, should expand. So you should always be able to represent a phased award simply by being more expansive and inclusive with your answers. But the platform team is thinking at the moment about other ways that we might handle that, and we will provide additional information on that in the future. At the moment, our suggestion would be simply to provide the data that describe your current study as well as you can.
Awesome. All right, next question. What if your study is a secondary data analysis? Will that make a difference?
I'm glad to take this if no one else wants to. I'm not sure whether this question is asking whether you are a HEAL-funded study doing secondary data analysis is absolutely welcome on the platform. And at some point in the future, there will be additional opportunities for things like code sharing and publications and so forth. So I think the answer to your question is yes. As far as data sharing, that's a different story. I suspect you would be analyzing data that would be available in some other way. If it's a more complicated situation, please contact us. We'd be glad to discuss it, but you are very welcome on the platform.
Awesome. Next question. Are there methods or tools for us to sync the metadata deposited during registration and what we'll need for data publication?
So I tried to answer that before when I talked about data submission. And so I think the answer would be yes here as well. That is to say, if you are publishing in a journal that requires you to share your data, you would presumably be sharing those data by depositing them in one of the repositories, and that metadata would then be available to you to transfer either directly, depending on which repository you're submitting to, or the platform has a mechanism where you can download that, and we will be making that even easier in the future for you to do.
Awesome. Next question. If your data are formative in nature, will they still be of value on the HEAL data platform? Anybody want to take that one?
I guess I would say yes, that I don't know that we know all the uses of the data in the future, but chances are there would be somebody that would have an interest.
Agreed. Okay. Next question. You mentioned the platform was just launched last summer, but also said registration was required within 1 year of award. Are we still timely?
I'll just answer that with one word, and it's yes. The timeline applies to newly funded awards, but obviously we're trying to bootstrap as many of the previously existing ones. But yes, by being here, you are definitely timely.
Awesome. Next question. Does the system send a notification that registration was successful or not successful?
I can take this one. So the system won't send a notification. However, when you submit the registration information, you will know right away whether or not it was successful. You'll get a confirmation message, but you won't be notified somewhere else that it was successful.
You will also, I just add to what Eric said, you will also, if you then go back and find your study on the platform on the discovery page, you will see a little badge there that says that your study has been linked after successful registration.
Nice. Next question. Should I register my study if I can't share my data?
I can take that one. So the answer is yes. You will not be asked to provide any sensitive information when you're registering on the platform or when you're filling out your CETA form. So yes, you should still register your study even if you don't plan on sharing your study data.
Thank you. Next question. How is registration different from registering our study in clinicaltrials.gov?
I can answer that. I think by registering your study on the HEAL platform, it allows it to be searchable on the HEAL platform. And that's where investigators that are within the HEAL community can go and search for potential collaborators. So even though you're registered on clinicaltrials.gov, unless you register your study, you won't be searchable on the platform.
Awesome. Next question. Does the HEAL platform collect papers that use the individual studies?
I'll answer that. It does not at the moment, but we are discussing such a feature in the future.
Awesome. Next question. Do you have written detailed description for metadata that can be used for submission to our institution's local IRB? We will specifically need details on the privacy protection and security of information.
I'm glad to answer this, but does somebody else? I mean, the one thing I would say is the metadata we've been talking about today are simply open access information about the study. So there's nothing that we're talking about here that would involve, or should involve any kind of a restriction. There absolutely is a detailed list of the items, and that is in one of the links that was provided in the chat above. That will, one of those, I think there were 3 links, one of them will give you a very detailed description of all of the metadata that you can use for whatever purpose you need.
Awesome. Okay, next question. Are there special considerations for phased awards, such as R61, R33s, where the nature of study activities may differ significantly across phases? For example, the R61 phase may include research not including human subjects, but the R33 phase may include a clinical trial with human subjects. There are different study characteristics, data collection timelines, clinicaltrials.gov registration to consider.
I think we sort of already answered that one, Gaurav, which was simply to acknowledge that that is a more complicated issue, and that for the moment, the best suggestion is to register and enter metadata for the part of the study that is underway at the moment, and there may be more information on how best to handle that in the future to come.
Awesome, thank you, and thank you. All right, last question for today. Why do I need to go to 2 separate platforms?
So I'm not the expert on this, but the truth is that there's security involved, and that in order to access the study and make sure that nobody's hacking the official study data, they want to clear who it is who's registering the study data.
One other thing I would add to that, thank you very much, is that the CEDAR system has a lot of fairly well-developed features for linking to existing ontologies and so forth. And so it really is optimized for the entry of a lot of these metadata, and that's why we're making use of it in this context.
Awesome. Well, thank you so much. And thank you to all our presenters, Phil Schumm, Eric Giger, Allie Gartland-Gray, and Brady Granier, and our panelists, Marisa Briones and Georgene Hergenroeder. We are very grateful for your insights. Next slide. Oh, no, sorry, this slide. In addition to our presenters and panelists, we would like to acknowledge the behind the scenes team listed here who worked diligently to bring this webinar to production. We could not have done it without them. Next slide. And thank you to the audience for your participation in today's webinar. We hope that you are leaving with a better understanding of registering your study on the HEAL data platform. In addition to a recording of this webinar, we will also email everyone who has registered for this event a list of resources that will assist you as you participate more deeply in the HEAL ecosystem. This slide deck will be shared, and a link to our Slack channel and Connect with Us form are located in the chat. We hope that you will reach out to us, the HEAL Stewards, for questions or support as you embark on your FAIR journey to maximize the value of HEAL data. Finally, we look forward to seeing you at our next webinar on December the 1st, focused on HEAL data management and sharing plan resources. Also, check out the upcoming HEAL data platform office hours on October 27th, November the 18th, and December the 7th for help registering your study. Details will also be shared in today's follow-up email. Have a wonderful afternoon, everyone.